our partnership developed, implemented, and evaluated an intervention known as HOMBRES, and that stands for Men Maintaining Wellness and Healthy Relationships. It was really the baby of our partnership, our community-based participatory research partnership, and it very much was developed in partnership with the Latino community and built on community strengths. So we really didn't want to go and say, what's the problem in this community? We really wanted to say, wow, this is a strong community. How can we meet their priorities and needs together? So very early on, we were sort of collecting formative data to say, okay, what are the needs, priorities, issues? What contributes to risk even? What's going on for the Latino community in this area? And during that process, it became very apparent very quickly the importance of the soccer league as a community asset. So we really partnered with them throughout the process of not only understanding the priorities and needs and developing the intervention, but developing it with and implementing and evaluating it with soccer league participation and partnership. So this is just a photo of sort of rural North Carolina. We partnered with a soccer league that had about 1,800 men. These are adult men, predominantly from southern Mexico, Guatemala, El Salvador, Central America. They've really come from very rural communities themselves, and they've come from communities that they haven't had really good exposure to HIV prevention, education. These communities that they come from are, not well resourced and struggling. So we developed the intervention based on formative data that we collected locally, and we made sure to, I'm the research scientist involved, and we really made sure that we included sort of state of the science. So we used health behavior theories, mainly social cognitive theory and empowerment education. Those theories seemed to resonate with our partners. It connected very nicely to the lived experiences of men. And it was a very interesting process to really sit around the table and say, okay, what is going on for men in this community? What is your experience? And wow, this is how it connects to theory. We chose to use a strategy of lay health advisors, and we called them navegantes. And our navegantes, what really came about was that the navegantes were going to serve three roles. So they were going to serve as lay health advisors, so giving information, providing referrals, telling someone how you would go about getting tested at the health department, or even how to use a condom, distributing condoms as well, or how to get free condoms in the community, where you would go or what you say at the health department, what tiendas or local grocers have free condoms, that kind of thing. They also served as opinion leaders. So our intervention really looked at what it means to be a man. So we wanted to bolster the good aspects of what it means to be a man and sort of reframe the negative. So a prime example is help-seeking behavior. So, lots of times all of us have men in our lives who don't want to ask for help maybe. And so that's something that, we can actually reframe and say, well, for a man to take care of family, to take care of self, to send money home, he needs to actually ask for help when he needs it. So we really spent some time figuring out what were some of the issues within the soccer teams and league, and trying to and developed our navegantes to sort of address some of those perspectives or cultural norms. We also wanted our lay health advisors to be community advocates. The idea was that the community has a variety of challenges or issues, and if people may not know what those are, so we wanted our lay health advisors to actually be able to advocate on behalf of their community, to understand how a board of health works, to understand how decisions are made around testing times or health department clinic times, so that they could actually walk into a room and advocate for something different or on behalf of their own community. So the intervention was designed to increase condom use and HIV testing. And our thought was that if we train navegantes, these lay health advisors, then they can go out and work with their teammates. And that came from the soccer league. Our soccer teams, during our formative data, we were collecting data, and we said, well, how would you actually get this information? How would you change norms within this community? And they said, well, train us. We hang out with each other. We help each other get a job. We help each other score a goal. We help each other with legal issues, get a car, those kinds of things. So why not harness that for us?